Okay, so now, okay, thank you. So now you can see my screen.
Correct. Yes.
Okay, thank you so much for clarifying that for me. So I'm going to just talk to you about what we presented at our Medicaid policy change review. It's going to also provide information on what we're doing and our implementation plan. The goal is to, as Zoe stated, to look at what the needs of Indiana are to apply for a waiver if that is something that will be beneficial to us. What we are implementing now are the requirements of the Consolidated Appropriations Act of 23, which made it mandatory for states to cover certain things. So basically, what we want to do is ensure that our state meets the mandatory requirements for the act, and that is that for individuals who are in carceral settings that have been adjudicated, means that they've been charged and serving their sentence. When they are discharging 30 days before, states have to provide EPSDT services, and that's the screening and diagnostic services, and TCM, which is targeted case management. And then 30 days after they are released, they get targeted case management. So we're implementing that, working very closely with DOC, Department of Corrections, and having them kind of work with us to get the process started so that we can have a blueprint for rolling this out across the state. Our go live date for Department of Corrections will be March 1st. So they'll start doing this practice in their facilities. Now, there are certain things that are currently happening, but what we will do is have a process in place for Medicaid to reimburse the diagnostic screenings and to cover some of the targeted case management that will happen in related to the screenings and then when they're discharged out. So the requirements apply to juveniles that were enrolled in Medicaid before becoming an inmate of a public institution or while an inmate of a public institution, and that they have to be in a suspended state. So that facility would have to have sent our DFR that information so that they can get that person suspended. So this, what we're calling a limited benefit, will take place while that person is in a suspended Medicaid status. And the facilities will be able to apply for this coverage 30 days before that individual is released. And then they will do warm handoffs to either CMHCs or FQHCs or a rural health center, wherever is close to that individual, a warm handoff so that they can continue TCM on the back end once they're released that 30 days. It is also, this benefit is eligible to those who are 21 years of age and under, and then former fosters. So between 18 to 26, if they're in that former foster group. So it's not a whole universe of eligibility. It is for those, one, you have to be adjudicated, you have to be in a suspended status, you have to be under the age of 21. And then if you are 18 to 26, you have to be a former foster. So that is who this applies to. And so you can't just be in a like detention center and has not had it adjudicated. It would have to be adjudicated, and you have some time for the sentence. At the time that we were collecting data and information, we estimated the population was about 415, and about 328 of those being in DOC facilities. So we've kind of already talked about what the requirements are and who they apply to. So it's those who are in those facilities serving time. What our recommendation was again that we will implement this coverage. We don't currently cover targeted case management like in our state plan just as a service. So we are in the process of submitting a SPA, and that is a state plan amendment to allow for these services to take place, this limited benefit for this population. We also had to develop a code, pick a code and look at reimbursement for targeted case management. So we went with T2023, which is targeted case management for special populations or institutions. It's a monthly code. We are requiring there be two touches, like two 30-minute touches to bill for the TCM, which would pay out at 189.56 a month. The screenings are already covered. EPSDT diagnostic screenings. We outline in an implementation guide that we will release for TCM and EPSDT. We outline the screenings, dental, behavioral health, physical health, the screenings that you can do. And we've kind of estimated some rough charges here about what the fiscal impact would be around. Not very much, because again, if you look at the prior slide that I showed you, about 415, 328 of those were DOC. So the costs are not very high for the screenings, about 104,000, 179 we estimated. But again, these are estimates, and could be a little bit different. We just kind of go through what the total cost would be: the 228,000, the 531 total for our implementation, right, with DOC, for those individuals who would start with getting case management and getting the screenings in the facilities that Medicaid would have to cover. So we did get awarded a grant. That grant was awarded to us in August. It was actually awarded August 11th of 2025. And the grant does not pay for any services. That grant pays for us to provide infrastructure, anything we need implementation wise for data sharing, and to ensure these benefits are put in place. Because if you've been around for a long time, just the justice world and Medicaid has been very siloed, and it has not really been working together to create better outcomes for people. So this what the Consolidated Appropriation Act did is kind of start that bridge, right? So that Medicaid and the justice system can begin to work together and cover services. Because this will be, there were some things that we covered under like PE, some inmate Medicaid, inpatient stuff, but this will be the first kind of coordination of care efforts that are being done from the Consolidated Appropriations Act. So we got awarded the grant. It is a 4-year grant. Our total award was $4.2 million. And our first year was 1.3 million for this waiver year, which ends, not waiver year, but for the grant year that ends June 30 of 2025. So we had to submit in January on the 30th our first summary report of kind of what we were able to accomplish and go through, and I'll talk through that here in a minute. But what we had budgeted to cover with the first year of the grant is a survey. We're working with WISE to get that survey completed. That survey will help us bring in data that will be helpful for disconnects as we launch this benefit, get feedback from those using it, feedback from stakeholders, so that we can begin to understand like what hurdles and things are in place and what needs to happen in more real time, more real data, as we look to shape, what the 1115 would need to waive and what kind of things we want to offer, in the state. We used it for system enhancements. 500,000 of it was proposed to deal with system enhancements. That's things to core that needs to change so this benefit could be put in place. There are changes in IEDs that need to happen. That's the state's eligibility system. For reports that are shared between facilities and Division of Family Resources in regards to suspensions, we needed to develop a cognos for the juveniles to continue to do suspensions there and focus in on the young population. We are proposing 75,000 for training. This is going to be DOC training, all training of different FSSA agencies, provider trainings, and even local community organizations training, so everybody can kind of understand the benefit and how it's accessed and who's able to get it. There's some travel embedded in there because if you know facilities are kind of all across the state, we'll have to go there. We'll attend a couple conferences just to ensure that we are linked in and have the up to date information of kind of what's happening in this space. And we take that into account as we're making decisions. We have also budgeted $530,000 for staffing and project management. We hired a project director, kind of like a reentry coordinator position. I am the person who is directing the project. We have our eligibility team involved. We have our compliance administrator involved. And then we have our eligibilities teams involved who will also help and ensure that the benefit is kicked off right, as well as our provider services team and our clinical team. So we have a lot of staff involved, but as far as like what the grant is covering is a proportion of the staff time that are already staff employees, our new position, and the project management to ensure that we get things completed. We have some indirect costs of around $50,000 as well. Our project timeline of kind of what we took a look at to roll out our first year, we've spent a lot of time on that interagency governance, just making sure we are setting the benefit up, working through all of that, working with DOC. Like I said, we've hired our reentry coordinator staff. We've worked on getting that survey out there, and we're working on currently our updates to the Medicaid systems, and we're developing data sharing prototypes and just being able to roll out with DOC. And like I said, DOC will go live March 1st, so that's exciting. And then we also did in December a couple webinars to keep stakeholders engaged. We'll continue to do opportunities like we're doing now to talk through what we're doing and making sure everybody's aware of the implementation. And then we'll have additional opportunities, like I said, for training and for engagement so that everybody's aware. Phase 2, we want to start rollout across our state. We're starting with DOC facilities, and then we'll begin to map out our plan for our rollout. So around May and June, we'll start looking at ways that we will involve other facilities and begin to bring them on board so that we can have statewide utilization of this limited benefit for EPSDT targeted case management 30 days before and 30 days after for these juveniles. And then these young adults that are the former fosters. So we'll begin to, in the second phase, year 2 and 3 of the grant, like I said, we'll expand across the state. We'll continue to look at our grant and the resources there and make sure we're pointing them towards the right stuff. Looking at our systems, data sharing, ways that we're able to share this information. We're coming up with some Tableau dashboards that we'll have and look at how we'll share those, with stakeholders and those who are also interested. We're doing a lot of work there. We're looking at just our internal policies and procedures and making sure we have marked all the things that will need to be updated. And in our phase 3, kind of sustain, optimize, and transition ongoing operations, because it's a 4-year grant. We're going to be looking at automation, making sure the data sharing things are automated, things that feed our reporting, like Tableau, and kind of work ourselves out of having to be hands-on like we are right now with the project, that it'll kind of run in the background, this limited benefit. So we drew out a SPA timeline. I think we are very close to submitting it. We have a question out to CMS. The question to CMS is, they had an attestation requirement for SPA where you just attest that you meet the requirements. And we just want to know if we can do one SPA with our service changes, benefit changes, and the attestation, or if we need to do two separate, do the attestation and that. So once we get that information back, we'll be able to submit the SPA, which will probably be before March 31st, but that's the deadline that we have to submit the SPA by. We have done a lot since we first presented this to PCR, which was in July 21st. PCR is something we have internally. It's policy change review. And anytime there's changes, whether it's a state plan amendment, a waiver change, or a rule change, we take it through the policy change review, which consists of like FSSA leadership and agency director heads are a part of that, and we make sure we're all in agreement on what is being proposed. So we've just done a lot. Like I said, we meet. We're working very hard to ensure that we're doing the stakeholder engagement and having opportunities for people to understand what's happening here. We really want to make data informed choices when we're talking about an 11 to 15 waiver, making sure that what we are recommending is really relevant and helpful and really does increase outcomes. So that's why we're really taking our time to make sure we're doing and then kind of understanding what we've done and the impacts of that. So I do want to leave time. It's about 8:53 for questions, or I can just tell you some things that we are just still in the process of working on, kind of outside of what I have presented.
The group have any questions?
If you do come up with some questions later, you can always email. It's medicaid@fssa.in.gov, and that will get to me and my team, and we'll, be able to answer your questions that way if you think of something later. Like I said, DLC is planning to go live March 1st. There's some training that will take place next week. I believe on the 16th, we'll go to the Pendleton facility, juvenile facility, and watch some training that will take place there. We're putting guides in place, like I said, so as we work with other facilities, we have a blueprint to kind of help them along. We are looking to set up more conversations, Zoe, with you and the council. We want to meet with the FQHCs because, again, in our first implementation, we're limiting that targeted case management to certain provider types just because it's such a limited benefit. It's only available those first 30 days. And I know that DLC gives a lot of referrals to you all already. So we want to capitalize on kind of what's in place and talk to you all and just make sure that we have worked out any issues or concerns that may be present before, there's a widespread of people, being involved in this. So it is limited at first, the providers that can help on the targeted case management side. And again, it's just because DLC gives referrals to, certain people, and we wanted to make sure that we had just understanding of how that is working with that short period of time that this benefit is in place for individuals.
And LaRisha, I will send our updated provider map to help with those conversations. And then also, just for your awareness, 12 of our community mental health centers are some form of federal qualified health center as well.
Okay, that's awesome.
Whether it be lookalike or full status.
That's good, because some of the things we've heard from DLC as some of these youth are discharging is sometimes there's a lack of engagement from like a guardian or parent, and some of these kiddos won't be driving. So how would they get in contact with the target case manager, or how's that connection? So we are allowing for telehealth visits and stuff like that to cut down on the dependence on having to get somewhere. So we will allow for telehealth stuff. And then also, I think another concern they talked about is they give a folder to individuals, I think, when they're leaving, that has a lot of information in it. And sometimes they find the folders in the trash, So, I think when people are leaving, some of the incarcerated settings that, they just, want to be done with everything. So they toss everything as they leave. But that folder has valuable information. So we've been trying to problem solve, like, how can we let it be known that, hey, this folder has a lot of information in it. It's going to be helpful to you as you are getting back into the community and services that will help you, so that they hold on to that folder. and actually, make the connection. And then how is it not a burden, like on your side, right? If you're getting referrals and trying to reach people, like how can we just make it where it's a seamless thing for on each side? So we're kind of trying to talk through those things.
Great. Any other questions from the group? Well, do you want to share next steps then, LaRisha, and kind of where we're at with everything?
Yes. So next steps, want to start with the end goal is to improve care and outcomes for the incarcerated juvenile population on Medicaid, and ensure that coordination and services from custody to care is seamless, right? That they're able to continue in and get the things they need. We also are looking to complete the survey, continue, like I said, our stakeholder engagement. We've already we've already done the state budget committee presentation, and that went forth in October of 2025. And so we'll continue to collect data, work with you all, and create a great opportunity for an 1115 if it's what's necessary for Indiana, and collaborate. The grant is 4 years. It's non-compete, so we will fill out a non-compete every April and continue to show progress, and we'll continue to get the grant money. And again, the grant money is helping with building a way to connect and collaborate and share data and that kind of thing. So if there's things that you think of was like, hey, it would be great if we had this ability or that ability, let's think through that while we have the grant money available that can help put systems in place in ways that we can collaborate better and in an easier manner. Take some advantage of some of these digital spaces and things that we can have while we have the opportunity to build stuff up. So I really appreciate the opportunity to come and talk about this implementation and initiative. And like I said, if you think of something, you can always email the Medicaid at fssa.in.gov. We'd love to talk with you and collaborate and hear from you. And Zoe will be in touch, like I said, to continue our collaboration, about the referrals of the targeted case management.
Can I ask just a really quick question? Thank you so much for your work in this area. It's so important. Can you go over again what the where the location of the target population is? So are these youth in local juvenile detention facilities? Have they already gone to DOC? Like where are they?
So from our conversation with DOC, it seems like a majority of these youth are going to be in their facilities, because they have to be adjudicated, right, being sentenced. So a detention center, they said youth may be there, but they may not be sentenced, right? To qualify for this benefit, they have to have been sentenced, right, serving time and then about to be discharged.
And do they have to be sentenced to DOC, or could they be doing local time?
They could be doing local time. Yeah.
Okay.
That's why we'll have a statewide ability to work with all facilities so they understand how to get those that qualify in their facilities access to the benefit.
But sorry, LaRisha, I'm stepping in. But just as a clarification, the first phase is just going to be DOC, and then the other facilities will be brought on board later.
I spoke to that in June, July, but in May we'll start having conversations, right, so that we can begin mid-year. So we'll start with DOC March 1st, and then mid-year we'll start bringing in other facilities, having trainings and opportunities like that, because there is a specialty that facilities will have to enroll in. Thanks, April.
Great question.
Well,
yes.
Yeah, it is. Thank you. I know we're over. I don't know. I think it's.
Oh yeah, it's okay. It's okay. We always go just a few over. We really appreciate the presentation. We will have this recording and we will have the slides available, and we will keep you posted as this work continues. LaRisha is really good at communicating and the follow through and making sure that the providers are involved. So we will, as this continues, we will, maybe even need to do like a part 2, right? Depending on where that planning is and what the needs are, LaRisha. So I'm always open to doing that. So thank you. Thank you to everybody who attended. We do have our Starbucks winner, and that is Chelsea at Radiant. So thank you, Chelsea. Yay! You get the Starbucks gift card. And we just wanted to, again, remind you about our State Hill Day on the 17th. If you've not registered, please do so today. Also, if you have not seen in the news, we are heading into a very active election season with local elections, a lot of changes. And so our PAC is critical right now in those conversations. If you have not donated yet this year, remember you do get a beautiful scarf that I should have had on, but I left it over there and didn't want to walk away from the conversation. So please donate to that PAC because it is really critical amongst everything that's going on in Indiana. And if you know of any members who can be in our tent around mental health and substance use advocacy, please let Leanne know of good potential members that could be part of our advocacy, both state and federally. So let's raise our cups. And cheers to all of you on this wonderful February, and look forward to seeing you guys on State Hill Day, or some of you maybe tonight at Who's Your Idol. We will be there representing our network. So appreciate you, LaRisha, for being on in April. And if there's anything that you guys need, please don't hesitate to reach out. Have a great day, everyone. Take care.
Thank you. Thanks for your partnership.
Yes, absolutely.
Mm-hmm.